Dr. Danielle Hansen of LECOM Health. She's the regional president. Dr. Danielle Hansen of LECOM Health is our guest here. She's the regional president of the organization. So we talked about your new role, and it really is expansive. And so I kind of maybe want to attack this geographically, and let's start with Corey.
Sure.
Because LECOM has a very major footprint in Corey. Tell us what's down there and what are some of the cool things that are happening.
Yeah. So in the Corey area, we obviously have Corey Community Hospital and Corey Rural Health Clinic. We also have Corey Counseling of LECOM Health. And then we have a independent living facility that's right next to the hospital and the Rural Health Clinic. And then in Union City, we also have another Rural Health Clinic.
Is the Corey Memorial Hospital a new build?
The Corey Memorial Hospital is, I think, 2012, I think.
Okay, that's not that long ago.
It's not that long. It's one of the newer.
Because didn't they leave one and then take over do a new one?
A new space, yeah. And the building itself is really fantastic.
Yeah.
The rooms are very comfortable for patients, very comfortable and efficient for the workforce as well. The Rural Health Clinic is a new build, fairly new build, right next to the hospital. It's attached, so you have all the amenities of the hospital and access for patients who might need diagnostic tests or have procedures or something before or after their doctor visit. And we have a lot of different specialists that go to that site as well. So it's not just primary care. There's a lot of different specialists there. We have walk-in availability too. So it's very nice, well-run.
What would be the typical thing that you would get at Corey Memorial there?
At the hospital?
At the hospital.
So Corey
I would think OB would be big.
I mean, they might come into the ER, and we do have OBGYN in the Rural Health Clinic, but we don't have a labor and delivery unit in the hospital.
Okay, gotcha.
Right. So Corey Hospital is a critical access hospital. There's 20 beds, and because of the critical access hospital status, the expectation for patients who are admitted there, they have to, on average, be there for 5 days. So somebody who might have a prolonged hospitalization might be more resource intense and might be better served at a different hospital, and those patients often get transferred to Mill Creek.
Okay.
Corey also has a swing bed capabilities so somebody who's done with their acute hospital stay, but needs a little bit more therapy before they're ready to go home, they can stay there and even in the same room for their rehab. They have swing beds, so the bed can kind of swing to a nursing home like bed or a rehab bed, and they can stay there for a bit longer before they're strong enough and ready to be discharged to home.
So at Corey, they would generally have a 5-day stay?
Yeah.
Okay.
Yeah.
So what would be the malady? I mean,
common things like pneumonia, COPD exacerbation, maybe CHF decompensation, those sorts of things. Some GI illnesses, more common bread and butter kind of medical surgical patients.
I was going to say a lot of older adults, especially with the congestive heart failure, and so I mean, again, once you get in there because your lungs are filled up.
Yeah,
you need a while to get that fixed, don't you?
Yeah.
Are you in the rehab business, LECOM?
LECOM?
Yeah.
I mean, we have the swing beds at Corey Hospital. At Mill Creek Community Hospital, we have an inpatient rehab unit, which is 14 beds. So that's the acute rehab where they get 3 therapy disciplines for 3 hours of therapy a day. And then we also have subacute rehab at all of our nursing home facilities.
Okay.
And obviously have multiple nursing home facilities.
Right.
And then even for people who need rehab at home, the Visiting Nurse Association is able to deliver those rehab services at home with PTOT and
So Schaefer Ab would do the 3-week Medicare rehab after, let's say, a knee surgery or something like that, right?
Yeah.
They could do that.
Yeah, so the subacute rehab that would be done at a nursing home could be done at LECOM Nursing and Rehab on Schaefer Avenue, or it could be at LECOM at Village Square, or at the LECOM Senior Living Center, or LECOM Elmwood.
Those places don't have any problems staying full, do they?
No, not typically.
I'm amazed at the demand level for both rehab and long-term care.
Yeah, and actually a lot of the hospitals have a hard time discharging patients because the post-acute patients' beds, the post-acute world has been so busy. So it's harder.
You ever hear those stories, well, we're going to give you 2 choices or 3 choices, and you're like, yeah, but,
Yeah.
it's we're in an interesting world right now,
We are.
aren't we?
We are in an interesting world. One of the challenges is having enough staff to meet the high demand of all of the patients. And that's in the hospital as well as in the post-acute setting. But to have enough staff to be able to do all of the work and care for all the members of the community.
Dr. Danielle Hansen is our guest here. After the bottom of the hour, I should say, we're gonna kind of go up Peach Street and see, some of the new facilities and some of the emerging, work that's being done up there at LECOM Health. You're tuned to Talk Erie and the Joel Natale Show. Thanks for tuning in to Talk Erie and the Joel Natale Show live from our Kingdom Financial Group studio here at 5th and State. And it's a delight to have with us in studio the regional president of LECOM Health, Dr. Danielle Hansen. She is a specialist in internal medicine and geriatrics, and also vice president of acute care, behavioral health. Man, you've got all the boxes checked over here with all the things.
All of the things, yes.
Let's go up Peach Street.
Yeah.
Well, before we come up, Peach, you said you have rural health in Wattsburg as well,
Right.
Union City and Quarry, right?
Yeah, Union City Quarry, Wattsburg was their newest rural health clinic. We also have one in Clymer, New York.
Okay, fantastic for all the skiers,
Yes.
and the farmers.
Yes.
And then as we make our way to Peach Street here, noticing that LECOM is poised for growth. I mean, the Toyota just left. Mm-hmm. We just built the ambulatory surgery center, and there's space there's some elbow room now on Peach, isn't there?
There is some elbow room on Peach, and there are other properties in that corridor that we have acquired over time as well. Yeah.
Fantastic.
And right now we have the current construction project going on at the hospital, where we're building a new emergency room on the first floor, and above that will be a new ICU and a new medical surgical unit.
What does emergency mean these days? Because when you think about it, okay, your kid's on the swings and they fall off and they crack their head open.
Yes.
All
Go
right?
to the emergency room.
Go to emergency. Yeah,
Or call an ambulance.
You can't handle that yourself.
You can't handle that at home, and you can't handle that showing up in a doctor's office either.
All right. So what's best practice for a parent that way?
Yeah. So, anytime there's like chest pain, stroke-like symptoms, those kinds of things, somebody would want to go to the emergency room. Any kind of accident where there's an injury, where something could be broken, or there's something's bleeding, maybe you need stitches, any of those kinds of things should certainly go to an emergency room. If in doubt, probably go and get checked out. Yeah.
Yeah. Even if your copay is $250, like I think mine is, it's worth.
Oh, your health
getting
is worth.
Yeah.
Yes.
Yeah.
And any potential sequelae if you don't get appropriate treatment at a rapid time frame.
Mm-hmm.
Yeah.
All right. So you're building this new ER.
Mm-hmm.
What would be the kind of the bells and whistles, or what is some of the new technology that comes to bear these days?
Yeah. And we just had the ribbon cutting for the ambulatory surgical center, like you pointed out. So that has a lot of new state-of-the-art equipment. Mm-hmm. The space is designed for patient comfort and for staff comfort. The same is true for our new emergency room. So state-of-the-art equipment, spacious rooms, all private rooms, those kinds of things. So it'll be very nice. Our behavioral health area of the new emergency room will be much larger than our existing behavioral health area. And it's also located in a more private setting. So it'll be more comfortable for patients, visitors, and supporters of the patients who come for the behavioral health evaluation, or for patients who are coming for other reasons to the emergency room.
What would be presenting, again, parent?
Sure.
But now it's not a crack a head open, but it's obviously my child is having an emergent crisis.
Yeah. So behavioral health crises can look differently, and can be a vast majority, or a vast type of different presentations. Certainly someone is feeling suicidal or has thoughts to hurt themselves, whether that's to end their life or just to hurt themselves. Those are things to present to the emergency room for. Also, if they want to hurt somebody else, changes in behavior, not being interested in usual activities, not taking good care of themselves, not eating or drinking what they should be or what would be normal, not sleeping, a change in those patterns. Other things that might present that might seem really bizarre. So delusions or paranoia, things of that nature that are new or different, are also reasons to present to the emergency room for a behavioral health evaluation.
Okay. And basically, when they come to the emergency room, you have the specialist there for that specific thing.
Yes. When people come to our emergency room for a behavioral health evaluation, they're evaluated by a psychiatrist. Mm-hmm. They see an assessment technician initially, and then they're evaluated by the psychiatrist, who's making the treatment decisions on whether they need to be treated as an inpatient or if their needs can be met in the community at one of the other settings of care.
Why do you think that Mill Creek has gotten such a good reputation with behavioral health, and especially emergency inpatient. I mean, the whole 9 yards.
Yeah, so Mill Creek has always, and LECOM Health really has always tried to meet the needs of the community. So seeing the growing needs for mental health services in our community and really across the country, and it's really exploded in the last several years too during the pandemic and thereafter. We've really tried to grow and meet those needs. So want to make sure that we have enough space for everybody who has an inpatient need. Want to make sure that we can also meet the outpatient needs on a timely basis. So our LECOM Institute for Behavioral Health is able to see patients very quickly to be seen by a psychiatrist or a psychiatric nurse practitioner. We're training the future generation of providers as well. We have our psychiatric residency program, and we have a child adolescent fellowship. So our providers, our practicing physicians are training the next generation, and that gives us more people who are able to provide the care as well.
When I know that hospitals have to, apply to the state when they're growing, right? You're adding ICU beds and so on. Even though our population is actually in decline in Erie County, are you finding that your demand stays steady?
Our demand is increasing. Certainly the demand on the mental health side has been increasing, and our market share is increasing. On the physical health side, our demand is also increasing as people are growing older. Then we have more people potentially needing hospitalization as they get older.
So it's the demographics that have changed. It's a demographic
shift.
Even though the actual number might be lower.
Right.
Wow. And again, the general hospital population might be made of just about any malady, right? Ortho,
yeah, absolutely,
cardiovascular, so the whole 9 yards, right?
Absolutely, yeah.
All right. So that's Mill Creek Community Hospital. You've got the new ambulatory center, like we talked about earlier, where a lot of procedures can be done. What did I hear? Cataracts
cataracts can be done there. Yeah.
Again, stents.
Yep.
And what were some of the big
things that can
volume,
be done? Yeah, at the ambulatory surgical center, cataracts, colonoscopies, EGDs, things done by the GI doctors.
Super fun.
Sorry, but necessary.
Yeah,
and important. Urology procedures can be done there. Podiatry procedures. A range of different things can certainly be done there. We do have a hybrid OR at the ambulatory surgical center, so vascular procedures and coronary procedures can be done there. In the new construction at the hospital, we also are building a new cath lab. And so that cath lab will do interventions and more urgent types of procedures. And for patients who need to be admitted to the hospital or higher risk, those kinds of things will be done at the hospital rather than the ambulatory surgical center.
I don't even know if they still call this, but like open heart surgery, is that still a thing?
That is still a thing. We will not be providing open heart surgery. If somebody needs that, they would get sent to one of our community partners.
Yeah.
That is still a thing. There are a lot of procedures, though, that can be done endovascularly now. So the recovery time is much faster. The time in the hospital is much shorter, and any risks associated with it are also minimized. So there are valve replacements and other sorts of things that can be done endovascularly instead of open heart. Nowadays.
Yeah. Okay. So when you have a blockage, there's just a lot of different ways to tackle that blockage.
To try to tackle it. Yeah. A lot of the blockages can be fixed by stents or the other
just think about 20 years, 30. Well, I worked for the hospital 40 years ago, so everything was open heart.
Yeah. Different world.
Sure is. My gosh. All right. So we've got Mill Creek Community. We talked about the surgery center. I want you to talk about some of the senior living things, as well as some of the other and of course the Achievement Center, because I'm really interested in how our kids are doing, because that's all outpatient, right?
The Achievement Center services are all outpatient. Yeah. They do work physically at the site of the Achievement Center where they do therapy and psychiatric care. But a lot of the work, the services that the Achievement Center provides is really out in the community, where our team members are seeing patients in the schools, in their homes, in different settings within the community to provide therapy and support for the patient and sometimes their family members.
Yeah. The And what does that look like? Is it individual care? Is it a lot of group therapy? Is it a lot of after school kind of help?
Yeah, not so much group therapy. It's
Okay.
mostly individual care.
Yeah.
Sometimes that individual care might be provided in a school. So it could be a one-on-one with somebody, or it could be somebody supporting a student through the class, through the class day or the school day. So maybe in the setting of others. And then we have some refocus rooms where we support efforts like that in some of the school districts as well, where kids can come to a room if they need to decompress, take some time,
Okay.
and do that in a structured and supportive setting.
Is there connection like with the community schools model that goes on with the Achievement Center so much? Or?
Yeah, the Achievement Center is partners with United Way in
Yeah.
the community school models in a couple of sites.
Yeah.
And there's certainly other partners throughout the community that support that model as well.
Talk about, again, that demand. What we're hearing from educators
Yes.
is that skyrocketed, that mental health and wraparound and
Yeah, and the
in
schools.
schools counseling is huge. Yeah.
Yeah. The schools themselves have increased the services and supports that they offer, and then Achievement Center, as well as some of the other community partners or community services
Yeah.
in our area, have also increased the supports that are provided within the schools. We're even doing psychiatry care at the school because it makes it so much easier for the students to receive the care, and makes it easier for the family members too. They don't have to worry about the transportation and how you're going to get them to see the doctor at the clinic. Our providers are going to the school districts and seeing the patients in the schools.
One of the things that always really not surprising, but actually was I thought was an amazing thing is that when you're dealing with a child that's struggling behaviorally,
Yes.
there needs to be a lot of care for the family, for the parents, right?
Oh, absolutely. Especially the first time you go through anything like that for a family member or parent, you might not know how to navigate the system. The system's complex, and there's a lot of steps that need to happen to actually access care, things that you wouldn't necessarily be aware of. You have to do an intake first before you can see a therapist or a provider, for example. So it's sometimes navigating the system, it's a complex system, which is great because we have a lot of supports and resources in our area, but it's also complex that makes it hard to navigate. So support does need to be there for those family members to help figure that out. We have a family-based mental health program too, where we partner with the parents or the household to help the student or help the child through whatever mental health issue they may be facing, working together. So our therapists guide the parents and provide direct therapy to the patient as well as to the parents, everybody working together to improve things for them.
I mean, a lot of it is, okay, when this happens, here's a better reaction than maybe what
Yes.
is intuitive to you or
Yes.
whatever.
Yes.
Yeah. And let's just face it, families, we don't get those skills necessarily
Right.
coming up, right?
Right. And the world right now has a lot of different pressures on
Yeah.
families and different stressors on families. Parents are trying to manage whoever else is in the household. Might be other kids and their needs. They're trying to manage their job, worrying about their income, worrying about all of those kinds of things that it's hard to necessarily navigate and to always have the right reaction and the right response
Right.
in times of stress.
Yeah. I'll let. I'm going to put you on go on a soapbox here about technology.
Okay.
Phones are dangerous.
Phones are dangerous. Yes.
All right. Yeah. What do you expand on that? Because I think parents need to understand that and kids need to understand that.
Yeah, and it's not just the phone, but any kind of access to internet or social media. Those kinds of things can certainly be dangerous. We would want to have parameters and controls over what our youth are able to access so that they don't go down a path where they're in a dangerous setting or being exposed to things that they're too young for, things that they shouldn't be exposed to. So the amount of time, the type of things that they could potentially get access to, all of those things can be very dangerous. Phones can be helpful if there's an emergency and we need to be able to call for help. They can be helpful in that way. Sometimes they can be helpful to know where somebody is too. If there's any difficulty locating somebody or they didn't get home on time or something like that. But there's a lot of dangers. There are a lot of parental controls that can be added to phones and features like that. And then certainly, screen time and all of those kinds of things. We want our young folks to be getting their homework done, and we want them to be enjoying the outdoors and being physically active and doing other kinds of healthy choices and not just glued to their screens.
There's no doubt. As you look at the trajectory of your career.
Yeah.
Do you feel that culture is fighting where this is at, where in you trying to build healthy families and healthy kids?
Yeah, I think it's probably on both ends of the spectrum.
Yeah.
I think that there's a lot of scientific advances in technology and things like that that can be very helpful. Like a continuous glucose monitor, for example,
Yeah, sure.
is a really helpful tool to manage diabetes that we didn't have access to that when I was first starting practice. And now I think that's really great. And I see patients whose, their blood sugar numbers are much, much better now. Their A1Cs are much better. So there's a lot of scientific and technology advances that can be very helpful for us. I think access to information is good as long as we're using good sources. Staying connected socially is good, but doing it through social media is certainly not my preference. But actually engaging and interacting with somebody face to face,
Sure.
there's a lot of value in that. In communication, text message versus an in-person conversation, you can say the same thing, but receive it very differently.
Right. Yes.
Right.
The text.
The text can be, and
Problems.
certainly anything beyond text in terms of fast messaging and things like that can have the same kind of challenges associated with it. So lots of science advances, technology advances that can be very useful and helpful for us in healthcare. A lot of potential challenges and negatives on the other end of that too, if used inappropriately.
How about people? You're now receiving Gen Z docs, aren't you?
Yes.
How is that?
Gen Z docs and Gen Z students, yes. Gen Z other workers in our workforce. Which brings it's different than the millennials.
Are you having to
than
kind
the
of
Gen
change
Xs.
management styles?
Yeah, I think Gen Z, my oldest is a Gen Z, so I can relate to that group easier, I think, than the millennials. The millennials are we're all learning how to manage and navigate that group of people, a very important part of our current and future workforce.
Right.
So those of us who have maybe managed using different styles in the past have to adopt to meet the younger workforce needs, whether it's millennials or Gen Z.
Yeah. We're going to leave it there. Did I miss anything? Did I hit all the...
I think you hit a lot. We covered a lot.
We did. We covered. Well, we kind of went from south to north and across 38th Street
and all the age spectrum.
Oh my gosh!
Different services. Yeah.
You got to hand it to LECOM for just. Again, what is it now? 25 years?
Yeah, I mean, LECOM has definitely dedicated to the community, has made a significant impact on the Erie community, but also across the United States. All of those healthcare professionals that are produced, who've received their training at LECOM, go on to other parts of the country. A lot of them are here locally, but they also go on to other parts of the country and make a significant impact on all those communities and patients served.
And it's based in Erie, Pennsylvania.
It is.
Dr. Danielle Hansen, the regional president of LECOM Health. Thank you so much for taking the time.
Oh, thank you.
It is 4:52 on Talk Erie.